The number of people dying as a result of drugs, alcohol, and suicide jumped 20% between 2019 and 2020. That's according to a new report released this morning by Trust for America's Health. Dr. Nadine Gracia, the president and CEO of Trust for America's Health, and also the former Deputy Assistant Secretary for Minority Health under the Obama administration, is joining us now via Zoom this morning to break down the results of this report and specifically how they apply to those of us living here in the state of Florida. So Dr. Data taken from the National Center for Health shows alcohol-related deaths in particular jumped 27%, while drug-related deaths rose 30%. And not all groups were impacted equally. Who was impacted most?
That's right. Certainly while we're seeing deaths due to alcohol, drug, and suicide impacting communities and populations all across the country, it doesn't impact all populations equally. We're seeing, for example, higher rates among our youth and young adults, as well as among certain communities of color. When we look at, for example, the rates of suicide are rising among the Black and Latino and American Indian populations, and in drug-related deaths, also increasing in the Black population as well.
As we dive into this more, and I'd like to bring it closer to home for our viewers here in our area, what kind of trend do you see specifically here in Florida?
Yes, also in the state of Florida, we have seen the rises in alcohol, drug, and suicide deaths between 2019 to 2020, an increase of 21%. And in particular, we're seeing rises in rates of synthetic opioids like fentanyl and psychostimulant drugs such as methamphetamine. These are issues that we're grappling with as a nation, and is not only the rise of these rates, but seeing it worsen during the pandemic because of what we saw from the stress and grief and anxiety and financial hardships and challenges that so many families and communities experience across the country.
Yeah, I'm just struck by one of the statistics in here in terms of growth of drug-induced deaths over the past 20 years. I think this just gives tremendous perspective. In the year 2000, there were 19,720. The year 2020 now, 20 years later, 96,096, to give you just a perspective on how much of a problem that this has become. Given that, do you have any suggestions for our viewers at home? How do you talk with loved ones, who may be struggling with drug and alcohol problems or mental health? Having that conversation, starting it, is oftentimes, from what we hear from professionals, the hardest part.
That's right. Unfortunately, we still, even despite this crisis that we're facing, stigma around mental health and addiction continues to exist. And yet what we need to understand is being able to address mental health and mental well-being and illness and addiction with empathy and understanding, and recognizing that many in our families and communities can struggle. And it's okay to talk about it. It's okay to seek help when you need it, and to ensure that help exists. We know what works to be able to address these rising crises. And so it's imperative that we as a nation now really commit to addressing the mental health and addiction crisis that we're facing across the country.
Such an important conversation to be had. Dr. Gracia, thank you for your perspective this morning. We appreciate it.